The importance of shared decision-making and consent in HVLA techniques. Now, imagine this. You're in a treatment room with your patient. They've come to you in pain, seeking relief, and you're prepared to use a high-velocity, low-amplitude thrust technique, or as we call it, an HVLA. Now, you know this technique inside out. You've spent years refining it, and to you, it's a powerful, safe, therapeutic intervention. But let me ask you this. Does your patient know what an HVLA truly entails? Do they understand its purpose, its risks, and what alternatives there are? If they don't fully grasp these things, can you really give consent? Now, the Chartered Society of Physiotherapists did a survey and they stated that on questioning, 50% of patients seeking a therapist did not feel included in their treatment and care decisions. 50% seeing a therapist didn't feel included. So let's break it down because it goes beyond simple consent. It's about shared decision-making, and this is the cornerstone of ethical, patient-centered care. Now, the concept might sound very straightforward, but in practice, it is transformative. It's a conversation, not a lecture where you dictate the treatment techniques that you'll be using. It's where you and your patients work together to decide on the best course of action for them. So why does this matter so much with a high velocity thrust technique? Well, firstly, because HVLA is not just another technique, it's precise, it can be forceful, and it does carry inherent risks. Miscommunication here isn't just inconvenient, it can be dangerous. If your patient doesn't fully understand what is happening, the technique could feel invasive, aggressive, or even harmful. And here's the stark reality. What's therapeutic in a treatment room with consent could be considered outside of the clinic room to be common assault without it. That's a serious distinction, and it hinges on informed, explicit consent, a consent that's only possible through shared decision-making. So how do we ensure we're practicing shared decision-making with every patient? Well, we can try and look at it simply step by step. So step one is explain the options clearly. Start by demystifying what is spinal manipulation. Use simple language, get rid of jargon. If you want to, maybe show dialogues or models to make it more visually understandable. Help your patients visualize what will happen during the treatment so they're informed and aware. Describe the expectations and the sensations they may hear or feel, the click, the crack, the sound of possible outcomes. Step two, discuss the benefits, the risks, and the alternatives. Manipulation is not just the only technique that we can use to elicit, these neurophysiological outcomes. There are lots of alternative techniques that we can use, such as mobilization or soft tissue techniques. And be honest, talk about the benefits HVLA can offer, relief from pain, improved mobility, but don't gloss over the risks. We have to mention there's potential for soreness, potential of adverse effects, and the fact that no treatment is risk-free. Discuss the risks relevant to the area you're working on, and also explain the safety processes that you've gone through to make sure that the patient is safe to have the technique. And always outline alternative treatment options. Patients need to know they have other options, not just manipulation. So step three, encourage questions. Now, here's where the magic happens. We want to create an open environment where patients feel safe to ask us questions. We can use prompts like, what concerns do you have about this technique? Is there anything you'd like me to clarify? This is where trust is built. But trust isn't enough. You have to confirm understanding. Now, we can ask our patients to summarize what we've discussed. So, for example, we could say to them, could you explain back to me what you understand by the technique and its risks. When your patient can articulate this clearly, you know that they've truly grasped the information. That's when you ask for their explicit consent. Not implied, not assumed, explicit. Now, let's also not forget consent isn't a one and done deal. Consent is an ongoing process. You must reassess consent at every session, especially if the treatment plan evolves or changes. Patients have the right to change their mind at any time, and you have the responsibility to respect that. Now, let's look and address the ethical gravity of what we do. Now, we know HVLA is a hands-on physical intervention. If done without consent, even with the best intentions, it can cross the line into harm. Remember, outside the treatment room, performing this technique on someone without their agreement would be considered a common assault in the eyes of the law. Just literally think about that. Consent isn't just a legal safeguard, it is a moral imperative. It's what separates a therapeutic act from a harmful one. Shared decision-making ensures that our patients are not just passive recipients of care, but active participants in their own health journey. It respects their autonomy, it builds trust, and protects them and us as practitioners. So next time you are prepared to use a high velocity thrust or any intervention really, I want you to stop. Just think, ask yourself, does my patient truly understand what I am about to do? Have they chosen this treatment willingly with all the facts in front of them? Because when patients consent from a place of knowledge and trust, our techniques become more than physical interventions. They become powerful tools of healing. And that's the care we owe them. So shared decision-making, clinical thought process is a wonderful way that we can build trust between us and the patients to make sure that we choose the appropriate techniques for the appropriate person and they are fully aware of what it is that we are looking to do within that treatment process.